Hello, everyone. This is Colin Murphy from the benefits team here at Dassault Systems. Certainly welcome to all of you. I'm glad that you can attend. Today's presentation is part of our open enrollment series. We've had two presentations that were the same, and those were focused more broadly on the overall open enrollment process. And if you weren't able to attend one of those sessions, we do have a recording available for you out on the rewards@3ds.com site. There's a special section specifically to 2019 open enrollment, and you can certainly find that presentation there. The presentation we're doing today focuses specifically on the three medical plans we offer here at Dassault Systems. And again, you'll be able to re-watch that if you want. Both the slide deck and the recording will be put in that open enrollment section of the rewards@3ds.com site. So throughout the presentation today, I'll be reviewing our Dassault Systems medical plans, and we'll focus specifically on the medical plans today. Please feel free to type in any questions that you may have throughout the presentation, and we'll try and answer some of those by text back to you during the presentation, and then we'll ask and answer some of those questions to the broader audience at the very end. So for today's presentation, we are going to focus on an overview of the three different medical plans and how they're covered, how services are covered, other features within the plan, your access to flex spending accounts or health savings accounts, and how those can enhance your medical plan coverage. Then we'll use three examples to walk through how claims would actually process through each of the three different medical plans, depending on low, moderate, or high usage. And then we'll spend a bit more time at the very end of our presentation focused on the health investment plan. I think for most of you, that is probably the plan that you're most unfamiliar with. So we'll spend a bit of time on that plan specifically, and then go through some scenarios and provide you with additional information as to how you can get help after today's presentation. So jumping right in to the three different medical plans that we offer here at Dassault Systems. We do offer three plans called the copay plan, the coinsurance plan, and the health investment plan. All three plans are through Blue Cross of Massachusetts, but again, regardless of where you are in the country, the provider is Blue Cross of Massachusetts, but there's coverage nationwide. There are some plan similarities and some plan differences between these three different plans. In terms of those similarities, every service that's covered under one plan is covered under all three. So you're not choosing a medical plan here through Dassault Systems because one plan is covering, say, chiropractic services or acupuncture. If any service is covered under one plan, it's covered under all three. The same goes for the network of providers. Again, we're working with Blue Cross. Blue Cross has one of the largest national networks of providers available to you. We find that our employees and their families typically do stay in network. It's about 99.8% usage in network. So thank you for that. That certainly provides savings to you and savings to the company. But again, that national network of providers is the same regardless of which plan you're on. And certainly if you have children, say, that go to college in another state, having them covered under one of our DS medical plans, you're not going to have any issue with them finding a provider in network, again, regardless of their location as well. Another key feature is the routine preventative services and age-appropriate screenings. We encourage our employees to take advantage of those. They're covered at no cost to you, regardless of which medical plan you choose. So go in for that annual physical. Make sure that you're getting those age-appropriate screenings so that you're identifying any health risks that you may have earlier and can take action on them to prevent them from becoming more serious. You're hearing more information lately about telehealth services. Again, telehealth services are an opportunity for you to receive medical care or behavioral health services through video conference. So anywhere that you've got video conference, whether that's your smartphone, a tablet, or your computer, you can set up appointments at the convenience or at a time that's convenient to you, meaning 24 hours a day there's access to these services. From the comfort of your home, from the office if you need to, etc. Anywhere that you want, you can have those telehealth services. That's especially important where if you've got a sick child that has an earache, that's a simple, easy one for a telehealth doctor to take advantage of. Certainly on the flip side, if you've got somebody with a broken arm, a telehealth visit isn't going to help you at all. But the telehealth services really do provide you with additional care and additional opportunities to get care, including getting prescriptions for things like an earache very conveniently. And then finally, on the plan similarities, the fitness and weight loss reimbursement programs. This is an opportunity for you to get reimbursed up to $150 per year for any type of fitness activity, whether that's participating in a YMCA or a Gold's Gym, or if you take classes like yoga, Zumba, Pilates, etc. You can get reimbursed up to $150 per year per household for that. And similarly, with the weight loss reimbursement, you're able to get reimbursed up to $150 per year for that program per household. And that applies to certainly Weight Watchers, any type of doctor prescribed weight loss program, or at this point, online programs that also include any type of counseling along with any type of online services that are included. But as long as there's counseling included, that would be eligible for reimbursement as well. In terms of the plan differences, really we start with the first one, the cost of coverage, the amount that you're paying out of your paycheck. The copay plan does cost more per pay period, and you may pay less at point of service, whereas the other two, the coinsurance plan and the health investment plan, cost less, but at time of service you do have the possibility of paying more for those services, and we'll get into that detail in a bit. The cost for care, again, going through the different ways that you're paying for services, your deductibles, coinsurance, and copays are different between the three different plans. And finally, your eligibility for a tax-free savings account. If you're enrolling in the health investment, or if you're not enrolled in one of our medical plans at all, you can participate in what's called a healthcare flex spending account. And we will spend some time on those in a bit. When we start talking about the services and how they're covered under each plan, I'd like you to notice again the top three lines: the routine physical care, physical exams, the age-appropriate screenings, the well child services, etc. Those are all covered at no cost under all three plans. This is that preventive care service that we really encourage both of the employees as well as their families to take advantage of. This is your first step in terms of making sure that you don't have any medical issues, or if you do have any medical issues, that you're identifying them sooner and are able to treat them quicker and potentially save yourself time, money, and effort based on how severe some of those cases is dropping below that line. So starting with the diagnostic primary care physician. And I'll start here really with the copay plan. The copay plan is named that, or we named the plan such, because all you're paying on that copay plan are copays, whether that's for office visits. You can see you're paying either $25 or $35, depending on the type of provider that you're going to see. You pay $100 for the emergency room, $30 for an MRI and CAT scan, and then you can see your prescriptions, you're paying either $10, $25, or $50. So every cost that you're having, presuming that you're going to an in-network provider, is solely a copay. It's designed to be very simple, easy to understand, and that's how that plan works. The coinsurance plan has some similarities, and that could be why it's attractive to you, specifically if primarily what your family is doing is just going in for office visits or getting prescription drugs. You can see that the copays are exactly the same as they are under the copay plan. So again, same copays for office visits, same copay for the emergency room, and so same copays for the prescription drugs that you may, your family member may take. Where you start to see the difference, or the difference between the copay and the coinsurance plan, surgery, etc. All of those services require that you pay a deductible, and we'll talk about that in a bit. It's $250 per person, up to $750 for the family. And once you've reached that deductible, you pay a 10% coinsurance, and you continue that until you reach your out-of-pocket maximum. So again, the copay and the coinsurance plan have a lot of items that are very similar, and it's just this one key area where you do have that coinsurance factor that you want to take into account when choosing your medical plan. This is really where that variable cost during the course of the year comes into play. Finally, the health investment plan. This plan, again, doesn't act really at all like the other two plans. There are no copays on the health investment plan, with the exception of preventive medications, which there are copays for those, specifically just because they want you to take those. Make sure that you're taking those and that cost is not a prohibitor from somebody taking those medications. But basically, on the health investment plan, what happens is you're paying 100% of the cost of any and all services until you reach your deductible limit. The health investment plan is what's known as a high deductible plan, so that deductible is high. Dassault Systems happens to set our deductible limit at the minimum that we can for this plan to still be what's considered a high deductible plan. That's $2,700 if you're signing up for employee-only coverage, or I'm sorry, $1,350 if you're signing up for individual coverage, or $2,700 if you're signing up for family coverage. And that family coverage does include employee plus spouse or employee plus children coverage as well. Once you've reached that deductible, then you're paying 10%. The plan is paying the other 90% until you reach your out-of-pocket maximum. And that applies not only to your office visits, your inpatient hospital stays, any types of labs, tests, x-rays, etc., but it also applies to your prescription. So if you're going in to pick up a prescription, be aware on the health investment plan that, again, where you may be used to paying a $10, $25, or $50 copay, at this point, what you're doing is you're paying 100% of the cost of that medication, and you'll continue to do that until you reach that medical plan annual deductible. Once you've reached that, then you're covered at 90%, you're paying 10%, continuing until you reach your out-of-pocket maximum. So let's take a look further at how the plans work, the deductibles, and what you have access to in terms of that tax-free tax savings account. So again, we talked about this before. The employee contributions, it's higher on the copay plan and it's lower on both the coinsurance and the health investment plan. We've actually priced the coinsurance and the health investment plan exactly the same. You'll see again on the copay plan, there's no deductible on this plan, and you do have an out-of-pocket max of $1,600 per person, up to a maximum of $4,800 per family. So in essence, on the copay plan, in order to reach that out-of-pocket maximum, you do have to incur a whole lot of copays, whether that's office visits, emergency room, prescription drugs. It takes a lot of copays in terms of reaching that out-of-pocket maximum. On the coinsurance plan, you have the deductible. It's a low deductible, $250 per person, up to a maximum of $750 for a family. So again, 3 people in your family would have to reach that $250 deductible in order to reach that $750. Or if you have a larger family than 3 people, it's that combination of people paying towards their deductible until your family as a whole has paid out a maximum of $750. But no one person would pay more than $250 towards their deductible. Again, on the coinsurance plan, if all you're doing is going in for office visits or the emergency room, you may not have much likelihood of hitting that out-of-pocket maximum. It's that same out-of-pocket maximum as the copay plan of $1,600 per person, up to a maximum of $4,800 for the family. But again, you do have that extra category, again, that inpatient hospital stays, the x-rays, labs, MRIs, CAT scans, etc. Those are all the types of items that are going towards the deductible, and then that coinsurance that would potentially have you reach that out-of-pocket maximum. Again, on the health investment plan, in terms of deductible, I mentioned this before, the deductible of $1,350 for an individual or $2,700 for the family. This acts a bit differently, and this applies for both the deductible and the out-of-pocket maximum. In this case, if you are signing up for employee-only coverage, you have that deductible of $1,350. Obviously, you would have to reach that, and once you've reached that, you would pay 10% of the cost until you reach your out-of-pocket maximum for any services beyond that $1,350. For family coverage, though, it's a bit different, and in this case, let's say you're covering yourself, your spouse, and 2 children. If any one of you, I should say, could reach that claims cost for the deductible of $2,700, and then similarly, one person in your family could incur all of the expense to cover that $5,200. So it's not on a per person basis on the health investment plan. It's based on what tier level you're signing up for. If you're signing up for employee plus spouse, employee plus children, or family coverage, that deductible applies to any one person in the plan and is inclusive of everyone in the plan. So any one person in the plan, again, can reach that $2,700 family deductible, and any one person in the plan can reach that total $5,200 out-of-pocket maximum. Okay. I did skip over this earlier, but the tax advantage savings accounts we mentioned before, you can participate in the flex spending account, the medical flex spending account, if you are in the copay or the co-insurance plan. This is where you can put aside money pre-tax to pay for those types of pay for expenses, and we'll talk about that in a bit. But really why I put this on this slide is for the health savings account on the health investment plan. Obviously, you're going to have an opportunity to put aside money as well, but the company is annually making a contribution to your health savings account for you if you're enrolled in that health investment plan. In this case, annually, the company is putting in $750 if you're signing up for employee-only coverage, and if you're signing up for family coverage, and then again, that includes the employee plus spouse or employee plus children, the company is putting in $1,500 annually into that health savings account to help you with that larger deductible and that larger out-of-pocket max expense that you have. I show you this screen, and hopefully everyone has seen this information before in terms of the employee cost sharing. Specifically, you've seen the information about how much you pay out of every paycheck for coverage in 2019. So again, if you're enrolling in the copay plan or you're enrolling in the co-insurance plan or the health investment plan, you're seeing on your screen these amounts that are deducted from your paycheck. What I really wanted to highlight on this slide is, again, the amount of money that you're paying out of your paycheck or the savings opportunity if you weren't on the copay plan, but enrolled in either the co-insurance or the health investment plan, the types of savings that you would have ranging anywhere from $1,000 for employee-only coverage up to $3,400 if you're enrolled in family coverage. So the reason why I bring that up is really for you to start thinking about, or for you potentially to think about, could I use that money that I have in savings and put it towards either one of these flex spending accounts or the health savings accounts to help pay for any potential expenses that I might incur? Or again, if I really don't have much in the way of expenses, that's a possibility for some significant savings that I can have year over year by not selecting the copay plan. Now again, we think that all three plans that we offer are great, but each of them are different in their own way. So when I talk about the possibility for savings, again, that's not for everyone. People are enrolling in the copay plan, the co-insurance, and the health investment plan for very different reasons, and that's why we offer three different plans. What I really wanted to highlight, though, is that if cost savings is something that you're interested in, that's types of savings that you could have by enrolling in something other than the copay plan. I know a lot of people that are enrolled in the copay plan, and they're absolutely willing to pay that higher premium. They feel that coverage is quote unquote the best. And in terms of out-of-pocket expense at time of service, that potentially could be, but when you look at the overall cost of what you're paying for, you might have an opportunity for some savings on one of the other plans. In terms of the tax advantage savings accounts, just to dive a bit deeper into these, again, with the healthcare flex spending account, this is available to you if you are enrolled in either our copay or the co-insurance plan, or perhaps if you're not enrolled in any of our medical plans, you have coverage through a spouse or a parent, perhaps, you could enroll in the healthcare flex spending account. Whereas if you are enrolled in the health investment plan, your option would be that health savings account. The healthcare FSA is managed through WageWorks, and the health savings account is through Health Equity. In terms of what types of eligible expenses, I broadly say that the eligible expenses are any type of out-of-pocket medical, dental, vision, or prescription drug expenses that you're incurring. But if you're looking to see a deeper dive into what those expenses are, the IRS puts out a publication. You can also go to the WageWorks site or to Health Equity to see a full list of the types of services that are covered or eligible for reimbursement under either an FSA or an HSA. Again, that list is identical for each plan, but your eligibility for one plan or the other is based on the type of medical coverage that you are enrolled in. I list here the IRS limit as to how much you can put into a flex spending account at $2,650, and that's listed as a 2018 rate. The IRS has not identified what the limits will be for 2019 yet, and I apologize for that. They usually come out right around October 31st. That information has not come out yet, so for the time being, we're expecting at least the same limit for 2018 as for 2019 as it was in 2018 of the $2,650. On the health savings account, you have an opportunity to put away quite a bit more. So if you are enrolled in the employee-only coverage, you can put away $3,500, whereas if you are enrolled in the family coverage, you can put away up to $7,000, and that's inclusive of that employer contribution. So again, Dassault Systems does make a contribution towards those HSA limits. Another attractive feature, again, with an HSA is similar to a 401k where there's a catch-up contribution for people age 50 or older. With an HSA, they have a similar component. It's for age 55 and older, where you can put away up to an additional $1,000. So a good opportunity to put away even more money tax-free. With a healthcare FSA, with a healthcare FSA, the flex spending account, this is what's called a use it or lose it plan. So whatever you sign up for, you have to make your elections here during open enrollment. You're going to have that election for the full year. So you have to estimate now what your expenses are going to be for the full calendar year 2019. If you don't spend what you put into that account, you lose that money or that excess money. So let's say you signed up for $2,000 and you had $1,500 worth of claims in the year. You can certainly get reimbursed for that $1,500, but you're going to lose that $500. So there's not flexibility within a healthcare FSA. Whereas on the health savings account, you put that money in, you can make your changes to your contributions anytime during the course of the year, and you'll never lose it. The money rolls over from one year to the next. So you are the owner of that health savings account, and whatever you don't spend in one calendar year, this rolls over to the next. And as I mentioned, during open enrollment, that's your time to make elections for the healthcare FSA. With the health savings account, you can certainly make elections as to how much you want to contribute to the plan here during open enrollment, but anytime during the course of the year, you are allowed to go in and adjust those contributions. So if you find that you can't afford to put in as much as you initially thought, you can reduce your contributions. And similarly, if you weren't really putting in any contributions at the beginning of the year, you incur some expenses and you want to put in some additional funds to help pay for those expenses with pre-tax dollars, you can adjust your contributions at any time during the course of the year. One benefit with a healthcare flex spending account, and that is that whatever you sign up for on an annual basis, meaning here during open enrollment, you have access to those funds from day one. So if, let's say you signed up for $2,000 in your healthcare FSA, and on January 2nd, your child goes in for orthodontia. Orthodontia, I know, is crazy expensive. I've had 2 of my 3 children go through it already. You put in that $2,000, they get that orthodontia treatment on January 2nd. You can get reimbursed that $2,000 right away. Even though you haven't put in, by January 2nd, we don't even get paid till January 3rd of 2019. You can get a reimbursement from your healthcare FSA before you've even made a contribution to the plan. On the flip side, with the health savings account, you can only get reimbursed for the funds you actually have in your account at that time. So if you don't have the funds in your HSA, you can't reimburse yourself for those at that time. Now, an attractive feature is a year from now, 10 years from now, if you haven't reimbursed yourself for an expense that you incurred, you can always go back and reimburse yourself for that for any time period that you've been enrolled in a high deductible plan. With both plans, you will receive a debit card. You can certainly use that at point of purchase if you want to. It's an attractive feature to help you pay for expenses, not having it come out of your credit card or pay with cash or check, etc. It's certainly a convenience feature. I certainly do also know a number of people that like to pay out of their own paychecks, whether it's for the healthcare FSA or the HSA, and then they can go back and they're earning points on their credit card for those expenses, and then turning around and getting themselves reimbursed. So again, you can file a claim, or with the healthcare FSA, if you're not using that debit card, you can submit a paper claim form, either online, I should say. You can do an online claim process. You can certainly print out a claim form and submit it. Whereas on the health savings account, you can log directly into your Health Equity account. Health Equity is the provider of our health savings accounts. All of your claims for medical, dental, vision, prescription drug automatically feed into that system, and you can pay providers directly from that system. Or if you've already paid the provider directly, you can go into that system and have Health Equity pay you back directly. So that's just some of the features between the 2 different flex spending accounts and the health savings accounts for you to consider and just know a bit more about. At this time, let's go ahead and jump into some of the scenarios that we have to try and help you understand how each medical plan would work for these participants. In this case, we have Raj, Susan, and Dan. Raj is a very low user. He's relatively healthy all the time, or has been, and we'll run through a scenario with him. Susan does have some expenses, whereas Dan really is a high user. He and his family are high users, have higher expenses. So if we'll start with Raj. In Raj's case, he's relatively healthy. He does go in for his primary care preventive screenings, his annual physical. He doesn't take any type of regular prescriptions. In his case, he does have one non-preventive, in essence, a diagnostic appointment with the doctor that requires some lab work, and based on that, he also was prescribed a prescription drug as well. He also had one visit to a specialist that year, but he doesn't contribute anything to a tax advantage savings account, whether that's the FSA or the HSA. So you can see on the copay plan, he paid $25 for his primary care visit. That was his non-preventive office visit. He paid $10 for that $13 prescription. He didn't have to pay anything at all for the lab work that he had. And then he paid a $35 copay for his specialist visit. So in total, his out-of-pocket expenses for his claims during the course of the year was $70. Okay. Again, he's enrolled in employee-only coverage, so he paid $1,608 throughout the course of the year for the payroll deduction. He paid $70 for the services during the course of the year, so his out-of-pocket cost for the year was $1,678. That's his total expense from a medical perspective for the 2019 plan year. If you were on the co-insurance plan, again, the routine physical was covered at no cost to him. He paid that same copay for the office visit, for the diagnostic visit. He had lab work, and again, he didn't reach his deductible, so he paid that full $200 for the lab work. And then for his prescription, he paid that same $10 copay as he would have on the copay plan, and that specialist visit as well, that $35 copay. So in his case, because that lab work is covered, he had a $250 deductible, and if he had spent more than that, he would have had co-insurance. In his case, his out-of-pocket expense for the claims during the course of the year was $270. He's only paying $550 for the year to have that co-insurance coverage, so his total cost at year end is $820. Okay. Our last scenario is with the health investment plan. Again, he paid nothing for that annual physical. He had to pay the full cost of that office visit for the non-preventive screening or visit, $150. He paid the full cost of the lab work. He paid the full cost of the prescription, and he paid the full cost of that specialist visit. So again, he never reached his deductible for the year. He spent $613 out of his pocket to pay for those expenses. He had that same $550 per pay period deduction, or not per pay period, but annual deductions from his paycheck. So his total cost was $1,163 out of his pocket to pay for medical care in 2019. The difference, though, is, again, because he enrolled in the health investment plan, the company gave him $750. So in essence, he's not paying $1,163. He could use that $750 to pay for most of that $613, or all of it, in essence. So he could have, in essence, had $550 out of his paycheck. The company contribution could have covered all of those out-of-pocket expenses, and you'd still have some money left over for the following year. Again, that money in that HSA would automatically roll over to the following year. Our next example is Susan. Susan has family coverage. In her case, she and her family have had moderate, we call it moderate usage. They had 9 preventive doctor visits, or 9 non-preventive doctor visits during the course of the year. She and her spouse both take a generic medication on a monthly basis. In addition, her spouse had some x-ray and lab work that was done. And again, she did not contribute at all to either a flex spending account or a health savings account. So again, with her preventive medication for her and her family, they paid $240 on the copay plan. The doctor visits, were $225, and in this case, they don't, on the copay plan, they don't pay anything for the X-rays or lab. So they paid a total of $465 out of their pocket for the claims that they experienced. Plus, they had the $5,775 that were deducted from payroll to be enrolled in the copay plan for family. So their total out-of-pocket cost was $6,240 for the year. On the co-insurance plan, or if she was enrolled in the co-insurance plan, again, no cost for the routine exams, the same cost for the preventive medications, the $240, just those copays for those prescriptions. The diagnostic visits are exactly the same for $225. The x-rays and labs, again, they paid $250 towards the deductible, or they paid their full $250 towards their husband's deductible, and then they still had a 10% co-insurance, so they paid $20 more. So in essence, that x-ray and lab up here, they paid a total of $270 towards that. So again, for their out-of-pocket costs for claims during the course of the year, Susan and her family paid $735. On a paycheck deduction basis, they paid $23.47 for the year, so their total cost was $3,082. The health investment plan, again, is where you're paying for all of these services until you reach your deductible. They're paying 100%. The preventive medication, it was preventive, so they were just paying the same copays that they would have paid on either the copay or the co-insurance plan. Diagnostic visits, they're paying the full cost of each of those visits for $1,170. X-rays and labs, again, they haven't reached their deductible yet, so they paid that full $450 for those services, and their total out-of-pocket expense was $1,860 for any types of claims incurred during the course of the year. They have that same payroll deduction as the co-insurance plan of $23.47, so their total cost out-of-pocket was $4,207 for the year. Again, she does have $1,500 that the company provided her. That contribution goes in with the first payroll of the year, so she could use that $1,500 to cover all but $360 of that total out-of-pocket expense for the year, if she so chose. Our last example in this category is Dan. Dan and he and his wife do have significant medical expenses, and in this case, can potentially reach their out-of-pocket maximum. They both take generic medications. They're both dealing with some chronic conditions. They have a number of non-preventive office visits. They both see specialists as well as get prescription drugs specifically related to their medical issues that they went to the specialist for. And sadly enough, both Dan and his spouse had to stay in the hospital for some conditions, and the average cost for that inpatient hospital stay was $15,000 each. And again, in this scenario, we didn't have him contributing anything towards either a healthcare FSA or HSA. So if we run through the copay plan, again, no cost visits with a specialist. Again, that's the higher copay of the $35 for each visit. The non-preventive medications, they just had to pay a $10 copay for each of those because it was a generic medication. And for the inpatient hospital stay on the copay plan, they don't pay anything. That's certainly an attractive feature on the copay plan. There's no cost for those services for the inpatient hospital stay. So you can see in his case, he had a total out-of-pocket cost of $800 for the year. He had payroll deductions of $39.70 for that employee plus spouse coverage. So their total out-of-pocket cost for the year was $4,770. On the co-insurance plan, again, you're seeing a number of these numbers exactly the same as the copay plan. The office, the prescription medication, the visits with the specialist, the non-preventive medications, those are all covered as copays. The difference here is with that inpatient hospital stay that they both had. In this case, each family member, both Dan and his spouse, paid $250 deductible for a total of $500, and then they would be responsible for an additional $2,950 to reach that $30,000 total expense. They would have a total cost expected of $3,450. However, because we have a per person out-of-pocket max of $1,600, this number was adjusted down to $2,400 due to their $3,200 out-of-pocket max. So they spent a total of $3,200 out of pocket for medical claims. They had the $1,614 deducted from their paychecks for a total of $4,814 for the year total medical cost. On the health investment plan, again, you're paying for everything. So $480 for the preventive medications, $1,600 for the specialist visits, $300 for the prescriptions, for the non-preventive prescriptions. Again, these are incurred, and you're paying 100% of the cost for each of these, except for that preventive medication. In that case, it was just the copays. Inpatient hospital stay, again, this is a large expense, and it's taking the family to their out-of-pocket maximum. Again, it was capped. They should have paid $3,288, but because of the $5,200 out-of-pocket max on the health investment plan, they were capped at paying $2,820 for that inpatient hospital stay. So again, in their case, their out-of-pocket max for the year was $5,200 plus the deductions from payroll totaled $1,614. So they had a total medical care cost of $6,814. Again, in this case, they have employee plus spouse coverage that's eligible for an employer contribution of $1,500. So if they use that employer contribution towards their medical expenses, they would be looking at around $5,300 as total expense for the calendar year. We took Dan one step further, and in this case, we did factor in what would happen if he was contributing to either a flex spending account or the health savings account. In our example, again, Dan would have to know going into the year how much he wanted to put into his flex spending account. So for our example, across all three plans, what we did was just took, let's assume that he had signed up for half of what his out-of-pocket max ended up being. So on the copay plan, he had total out-of-pocket expenses of $800, so we had him contribute $400 to his FSA for that year. On the co-insurance plan, that had an out-of-pocket max of $3,200, and so we had him put in $1,600 in this case. And on the health investment plan, it had the $5,200, and we had him contributing $2,600 to his health savings account. The reason why we added this slide in is so you can really see some of the advantages of participating in the flex spending account or the health savings account in terms of tax savings. We assume a 35% contribution rate. Those funds that you're contributing to the FSA or the HSA are able to get reimbursed by you. So that's money going out of your paycheck, but coming back to you as reimbursement. So the net cost across each plan would be $46.30, including the claims for the year, the cost of coverage through Dassault Systems, that payroll deduction, any contribution the company made, like in the case of the health savings, health investment plan, the $1,500 that goes in, and then subtracting out the tax savings that you would get from your flex spending account or health savings account. So again, taking advantage of these flex spending accounts or health savings accounts can significantly save you some real dollars. $140 if you're on the copay plan, or again, $140 if you were contributing $400, $560 if you contributed $1,600, $910 if you're contributing $2,600. So it's really mostly on this slide, it's focusing on your opportunity for additional savings beyond just which medical plan are you signing up for, but where else can you take advantage of savings? And that would be through either that flex spending account or health savings account, and really tying that into your overall cost of coverage during the course of the year. Okay, so at this point, again, I think we've covered all three medical plans in some detail. I'm going to spend a little bit more time on the health investment plan, but most specifically on the health savings account, because the health savings account really is the attractive feature when enrolling in the health investment plan. So just going over a few items really quickly, the deductible on the health investment plan, $1,350 or $2,700, depending on the level of coverage. You'll pay that. Then after you've reached your deductible, you'd have co-insurance for services. You'd be paying 10% of the cost. The plan is paying 90% up until you reach your out-of-pocket maximum. For 2019, that out-of-pocket maximum is $2,600 for employee-only coverage, or $5,200 for family. And then, like I said, the health savings account, and this is where we're going to spend a bit of time. Not only is the company making a contribution on your behalf, but you're able to put in money as well. So we wanted you to really understand how that works. And again, you have the opportunity to have money deducted from your paycheck pre-tax, and we just saw on that example with Dan of the kind of savings that you can have in terms of lowering your taxable income during the course of the year. And that can be used to pay for expenses either this year, so you pay money into your account, you have expenses, you reimburse yourself this year. That money is tax-free going in, tax-free coming out. It's really the best tax savings tool that exists within the U.S. At this point. Or your other option is to pay those any expenses that you have, or if you didn't have any expenses, the money that you put in that health savings account rolls over from year to year. And once you reach a balance of $2,000 in your health savings account, you actually have the ability to start investing those funds similar to what you do in your 401k plan. So not only are you putting aside money tax-free, but now you have the ability to invest that money and hopefully have it grow for you for the long term. The health investment plan and the health savings account as a team are really designed to help you start thinking about your healthcare long term. And I'll throw this number out to you, and it's what Fidelity has provided in terms of really the reason why a person wants to build up that health savings account and think about the health, or in our case, the health investment plan and having a health savings account. They estimate that the average couple in retirement from age 65 through end of life are expected to spend about $280,000 in medical care costs between retirement age and end of life. So that's $280,000 that you're going to have to pay for in one form or another. Now, certainly you're going to have retirement savings through your 401k and potentially other savings as well. Every one of those options you're paying taxes on, either when you put the money in or when you pull those funds out, or again, if it's just a savings account, you're taxed from payroll deductions. With a health savings account, if you can build up that account balance or anything that you put into that account balance that has the opportunity to grow over time, you put that money in tax-free and you're able to pull it out tax-free. So instead of paying those medical expenses out of your 401k where you've been taxed on those funds, the health savings account allows you to put aside money and pay for those expenses with tax-free dollars, which is a very attractive feature. And you never have any fear of losing that money. The health savings account is in your name. It always belongs to you, whether you are here at Dassault Systems or you leave or you retire, etc. That money in that HSA always belongs to you and can always be used to pay for any type of out-of-pocket medical, dental, vision, or prescription drug expenses. Okay. Again, we talked about that money coming out tax-free and the ability for it to roll over. What we really want to highlight here is your opportunity, along with the company, to build up that health savings account. So again, on an annual basis, the company is contributing either $750 or $1,500 to your account. For 2019, you're able to contribute an additional $2,750 or $5,500 into your account. And then, like I mentioned earlier, there is a catch-up contribution, which allows anybody age 55 or older to contribute an additional $1,000. So this is really a great tool if you're looking to really build up that account balance and thinking about your healthcare long-term, not just while you're an employee at Dassault Systems or not specifically thinking about 2019. But in essence, as you can see from the maximum contributions, the $3,500 or the $7,000, that's higher than our medical plans, any of our medical plans have in terms of an out-of-pocket maximum. So with the health investment plan, you have an out-of-pocket maximum of $2,600 on the employee-only plan. So that means that you'd still have $900 that would roll over to 2020 or beyond, or that you can use those funds towards any type of dental or vision expenses that you might incur. Similarly, on the family side, our out-of-pocket maximum is $5,200. So that's leaving you $1,800 to use towards dental or vision expenses, or again, roll over to future years. So you're able to really build up an account over time by contributing to a health savings account. Some key features with a health savings account that we want to make sure that you're aware of. If you are enrolled or if you do want to participate in the health investment plan within HSA, you can't be enrolled in another medical plan. So you can't choose a plan like our co-pay plan or a co-insurance plan through your spouse and be double covered on the DS side. You can only be in a high deductible plan. You can't have that double coverage perspective. And similarly, if you're participating in the health savings account, you aren't eligible for the healthcare FSA. You can't use your HSA to pay for the payroll deductions that you have from your paycheck. And the reason for that is those payroll deductions for medical premiums are already deducted out of your paycheck pre-tax. So there's no additional tax savings that you can receive from that. You're already getting that tax-free savings. However, in the future, if you leave Dassault Systems and you want to enroll in COBRA, which is your ability to continue coverage after you left Dassault Systems for a period of time, you could use your HSA funds to pay those premiums. And similarly, I know a lot of people are asking about the opportunity to use your HSA savings to pay for any type of Medicare or Medicare supplement insurance. And absolutely, those premiums would be normally taxed if you're paying it with non-HSA dollars. You can use your HSA to pay for those types of expenses. As I mentioned before, that HSA account always belongs to you. So if you leave Dassault Systems, you absolutely have the ability to continue using that account through Health Equity. You can also roll it over to your new employer if you want to, or any other HSA provider. If your balance falls below $2,500 and you're not participating in our health investment plan, you would have to pay administrative fees. I believe it's $3.95 per month. So again, whether you're still with Dassault Systems but not in the health investment plan and your balance is below $2,500, you would have that administrative fee. For 2019, if you're enrolled in the health investment plan and then you switch to a different plan in some future year, so let's say you're in the health investment plan for 2019, you decide, you know what, I think I prefer the co-insurance plan or the co-pay plan for 2020. The funds that are in your health savings account can still be used. You can still use them to pay those co-pays or co-insurance, any of your out-of-pocket medical, dental, vision, prescription drug expenses. The big difference is you won't be able to contribute to that health savings account anymore. Obviously, the company wouldn't be making a contribution as well, but you can only contribute to a health savings account while you are participating in a high deductible plan like our health investment plan. The last note here is regarding dependents. The funds in your HSA can be used for for you or any tax dependent of yours. So you do have the ability to cover additional people on your plan, such as, say, a domestic partner or perhaps an overage, I don't want to say an overage dependent, but a dependent that is no longer your tax dependent. You can cover them on your health investment plan. You just can't use your funds in your HSA to pay for or reimburse yourself for those expenses. Your dependent can certainly sign up for their own health savings account, whether it's through Health Equity or anybody else, and fund it that way. But you can't use the funds that you've put aside towards any non-tax dependent. We'll run through quickly a few more examples, in this case on the health investment plan, and I'll go a bit quicker through these because we've gone through some scenarios already. Again, we've got Steve, Julia, and Puneet. In this case, Steve is a low user. Julia is typically a low user, but has a significant medical event in 1 year, and Puneet is a high user. So let's walk through those scenarios. We'll start with Steve. Again, he's relatively healthy. He doesn't really go to the doctor, doesn't incur expenses very often. You can see in year one, he has contributed, or the company has made a contribution of $750 to his health savings account. He didn't have any claims in year one. So at the end of the year, he's got an HSA balance still at $750. Rolling into year two, the company does make a contribution on his behalf, $750 again. He decides that he wants to start taking advantage of some of that tax savings, so he contributes $1,000. He does have some expenses during the course of the year, totaling $452, and he decides to reimburse himself, not the full $452, he decides to reimburse himself $300 that year. So he has $2,200 left in his account going into year three. In year three, he happened to have gotten married, so he's added his spouse to the plan. So now he's getting a $1,500 contribution from the company. He's upped his contributions to $2,000. His spouse has purchased a pair of glasses that cost $250, and he reimburses himself for that $250. So by the end of year three, he's got now a balance of $5,450. you can see over time, if you're making contributions and you have low expenses or you're not reimbursing yourself, you can build up your health savings account over time. At any point, and I want to point this out, again, in year 2, he incurred $452, reimbursed himself for $300. He decided not to reimburse himself that additional $152. At any point in the future, whether it's in year 3, year 10, year 20, he can reimburse himself for that $152. He just has chosen not to do it at the present time. And in our scenario, I think he did that specifically so that he can really focus on investing his funds going forward. Okay. Julia, on the other hand, relatively healthy. And so in year 1, really doesn't do much in terms of medical care, has $750 contribution from the company and also makes $600 contribution on her behalf or out of her own paycheck for $1,350 year-end balance. Year 2, unfortunately, she gets into a mountain biking accident and has huge expenses, $35,000 worth of care. In her case, she's enrolled in employee-only coverage, so she has an out-of-pocket max of $2,600. So in her case, by year 2, the company made its contribution of $750. She didn't have enough to cover that, so she pays $2,600 out of her pocket and has reimbursed herself $2,100. That's the amount that she had in her account at that time. So she ends year 2 with no money left in her account. And please note, again, she had $500 that she has paid out of her pocket and wasn't able to reimburse herself at this time. Going into year 3, she contributes $750, or the company makes the contribution of $750. She really wants to start building up her balance again, so she adds $2,000 of her own dollars. She has less expenses. It's more of a typical year for her, so $250 worth of expenses in the year. And she decides to reimburse herself not only the $500 from last year, but the $250 from this year. So at the end of year 3, she now has $2,000 that will again roll into year 4. Okay. Puneet is our more serious medical conditions. In this case, he's covering he and his spouse. They both have significant medical issues. And on top of that, really his focus is of building up a health savings account because he knows in the coming years he needs to have a knee replacement. So he's really focused on 2 things. One is building up his health savings account, not only for the present or really for his future, but he's got the liquid assets to really fund and max out his contributions. In his case, he is over age 55. He's nearing retirement and contributes the maximum that he can. So he's doing the $1,500 employer contribution. He's doing not only the $5,500 employee contribution, but also the catch-up contribution. He has expenses in year 1 of $3,150. He chooses not to reimburse himself at all. So by year end, he's got $8,000 in that account, again, that he can invest. Going into year 2, still gets that employer contribution, still makes his max contribution available, including the catch-up. He has his claims for the year total $2,971. Again, he doesn't reimburse anything. So again, $3,150, $2,971. He hasn't reimbursed himself anything at this point. He has $16,000 in his account. At any point in the future, he can decide to reimburse himself for that. In year 3, this is the big year. He's having his knee replacement. It makes he and his family reach that out-of-pocket maximum. So he decides for this particular instance, the $5,200 out of pocket, that's a bit more than he wanted to handle. So he does reimburse himself the full $5,200 for that out-of-pocket maximum for the year. So by the end of the year, year 3, he has $18,800 in his account. And again, he's really building that account up so he's got some funds in retirement to pay for any type of, whether that's Medicare premiums or out-of-pocket expenses. So he's really focused more on that long-term view of his health savings account. That wrapped up really the scenarios. I wanted to highlight medical plan cost estimator. That tool is available to help you in deciding which medical plan is best for you. Again, Dassault Systems really believes that all 3 medical plans that we offer are very good. We don't think that you're going to go wrong choosing any one of the 3. There are options that may be more attractive to one individual person or family that makes one plan the right choice or a better choice for you, and that's by using things like the medical plan cost estimator or attending this webinar can help you figure out what's right for you and your family. Open enrollment is your time to make changes for 2019. You've heard that from us already before, so please go into the ADP tool, of course, number listed on your screen to make those elections. Again, this is a passive enrollment, so if you're happy with whatever you have in terms of benefits today, you don't have to do anything. We do encourage all of our employees, though, to go into the system for two reasons. One is medical and dependent care FSAs, which we didn't talk about dependent care FSAs today, and health savings accounts. You do have to re-enroll in those every year. And similarly, we strongly encourage everyone to go into the system during open enrollment to also review your beneficiary information. It is certainly important. We provide a number of benefits to you, life and AD&D as examples that include beneficiaries. So it's helpful to our team if you have beneficiaries listed in case anything ever did happen to you. So please take this time during open enrollment to review and, if needed, update your beneficiary information. After today, if you have questions, you can certainly contact our DS Benefits Center. They are really designed to help you with any type of enrollment issues that you may be having. So if you are trying to enroll online and you're having any troubles, you can certainly call them, do your enrollment over the phone, or you can send them an email for any assistance that you may need. Any other benefit questions you have, things like, I don't really understand this medical plan, or I'm having an issue with a claim, etc., you can submit tickets to our People Support Center, and they're designed to help you. If our People Support Center first line can't assist you, they'll pass it on to our benefits team and we'll answer you as well. So at this time, if we have any questions, I know I've gone long. I went longer than I intended to, so we're at 2 o'clock, but we'll stay on the line for a few minutes and answer any questions that you may have.
Hi, Colin, you're right. We have a lot of questions, a lot of great questions. So thanks for saying, you know, everybody on the phone, if you have a question and we haven't got back to you, you know, online, feel free to put in a ticket and we'll get back to you that way. Okay. The other thing that I just want to remind you of is that open enrollment does end November 9th. I know a lot of you have been asking that question. And some of you have also asked, what happens if you've already submitted your change? Can you make a change between now and November 9th? And the answer to that is yes, you can. And Colin, would you like to tell them how they can do that?
Sure. So certainly you can call the DS Benefits Center at the numbers on the screen currently. And the other option, I believe you can still actually reopen your open enrollment. So you can log back into the ADP tool and try and re-enroll that way. But if you're having any issues with the online tool, certainly call the DS Benefits Center.
And then the other thing that you mentioned a little bit about talking about beneficiaries. We had a question that came in. What happens to the money in your HSA account if you pass away?
Absolutely, and I should have reiterated that or said that, and that is your health savings account does include an opportunity for you to enter beneficiary information into that health equity portal. So if anything ever were to happen to you, any funds that are left in your health savings account would automatically then go to who you list as your beneficiary.
And also, can you explain the difference between a deductible and the out-of-pocket max?
Sure. So a deductible is something you're paying 100% of the cost of, and let me go back so we can see some examples of that. So the deductible you're paying 100% of the cost of. So in our case, our co-insurance plan and the health investment plan are the two plans that have a deductible. The deductible basically means you're paying 100% of the cost of those services until you reach that deductible limit. So on the co-insurance plan, you have a $250 deductible that applies to things like the MRIs and CAT scans, inpatient hospital stay or outpatient surgery, etc. So you're paying the first $250 for any of those types of services in a calendar year. Once you've hit that $250, you're paying co-insurance. You're paying 10% of the cost of those services until you reach your out-of-pocket maximum. On the health investment plan, the deductible is higher, in this case, $2,700 or $1,350 or $2,700, depending on your level of coverage, you're paying 100% of the cost of any and all these services. So if you're going to a doctor's visit, let's say, costs $150 to $200, you're paying that full $150 or $200 for that office visit on the health investment plan through the deductible. So once you've spent $1,350 or $2,700, you're paying the full cost of any and all of those services. Once you've reached that, then you're paying the co-insurance, and that's where you're paying 10% of the cost until you reach out-of-pocket maximum.
And the other thing, while we're talking about that, do dental expenses, out-of-pocket dental expenses, count towards your out-of-pocket maximum if you're participating in the HIP and the HSA?
No. So on what the out-of-pocket maximums on all three plans, the copay, co-insurance, health investment plan, those are specifically referring to your medical and prescription drug expenses. The dental plan expenses do not count towards, again, in the case of the question, the health investment plan. The dental plan in and of itself has a $2,000 calendar year max as in terms of what the plan will cover. Any expenses that you're incurring on the dental plan, those are totally separate. Again, you can use your health savings account to reimburse yourself, but they're not applying towards those deductible or out-of-pocket max on the medical plan.
And then what about with Express Scripts, Colin? Does Express Scripts know for the people that are participating in the health investment plan when they've reached their deductible for the individual or for the family?
Yes. So for all three plans, technically, Blue Cross and Express Scripts are feeding information on a daily basis in terms of claims and claims processes. Now, keep in mind, a claim could go through on the medical side that doesn't happen immediately. So you have a doctor's appointment on July 1st. You're not getting a bill for that until, say, July 30th. Whereas from that doctor's visit, you go in for a prescription, you're paying that on July, or you're picking it up on July 2nd. So the timing of different services are happening at different times. But Blue Cross and and Express Scripts do talk to each other or send files to each other on a daily basis. So those should all catch up to each other in the end.
All right, I think that's good for today, Colin. We've gone almost 5 minutes over our limit.
Okay.
So we'll wrap it up.
Yeah, so I am sure that there are a lot of questions out there that we didn't get to, so please submit a people support ticket and we'd be happy to assist you with any additional questions. But thank you for your time today, and we appreciate you taking the time from your day to hopefully figure out which medical plan is right for you.